Hello and welcome to my channel. This is Dr. Victoria Givens, your board-certified facial plastic surgeon and owner of Givens Facial Plastic Surgery in Austin, Texas. All right, so here we go with the topic of the day, aging of the lower face and neckline. Overall, the effects of gravity, genetics, external stressors, and weight fluctuations contribute to the visible signs of aging and loss of facial definition. This results in descent of our skin and underlying tissues, and ultimately the face and neck begin to hollow and sag. I'm often asked if these changes are preventable or avoidable to a certain extent. And while there are ways to optimize your body for the aging process, the real answer is not really. Patterns of aging are quite variable, and when discussing the lower face and neck, we really need to consider the skin and its underlying layers, the fat, muscle, and bone, before we can make any determination of a customized treatment plan. So first off, let's talk about the skin. Changes in the skin are often the most visible feature with aging. Sun damage, pollution, as well as primary and secondhand smoke exposure all contribute to skin aging, including laxity, photo damage, lines, and wrinkles. This, coupled with the constant force of gravity, which exerts an actual mechanical pull on the already unsupported and lax skin, exposes age-related changes to the deeper structures that have lost structural support beneath the skin. Next is the submental fat, which is located directly below the skin and is generally the most prominent in the submental or beneath the chin region, along the jowls and jawline. Fat accumulation in this area is a normal part of aging, and it's often refractory to diet and exercise, meaning permanent removal with surgery is required. Next is the muscle layer, which is located below that fat layer, and it extends like a sheet across the neck from the chin and jawline down to the clavicles, or that front of the shoulder blade region, and is continuous with portions of the descending tissues of the face. This is quite possibly the most important layer we consider with treatment options, because as we age, the muscle layer begins to lose tone and is pulled laterally, resulting in splaying of those muscle fibers and laxity of the support structure, and the final outcome is that dreaded turkey neck or neck banding. And finally, we have to keep in mind our hardiest structural support system where everything attaches to, the bony structures, namely the prominence of the chin, the sharpness of jawline definition, and the inherent position of the CMA, or that neck-defining angle. The definition or location of these structures truly determines the crispness of one's treatment outcome. Now, I always find that if you understand the reasons behind why we age, you can more easily comprehend what the best treatment options are, whether surgical or non-surgical. If you found this helpful, I encourage you to watch my other videos on treatment options and recovery. As always, we know that personal transformation is one of life's most meaningful journeys, and Givens Facial Plastic Surgery offers a comprehensive, customized approach designed to reveal unrivaled yet natural aesthetic results for those who refuse to settle for anything less than the very best. Thank you for watching. You can find all of my office's contact information and social media platforms below this video on my channel. Don't forget to subscribe, and I will see you soon.